have the urinary incontinence because...
This is where we start reversing age.
So my name is Erica, and we are here at the Nitra channel in Reno, Nevada. We are here with Dr. Waldorf and Dr. Wolfe. Can you both introduce yourselves, talk a little bit about your practice, and what brought you here?
Dr. Tom Waldorf, I'm the chiropractic physician and CEO of Active Life Integrated Health.
Dr. Aaron Wolfe, and I do homeopathy and functional integrated medicine.
Great. So every hero has their origin story. What brought you guys here? What twists, if any, took you into the healthcare path?
Well, for me, I started with my mom having a low back injury and her saying, "Can you work on my back? It really hurts right now." And she'd always tell me, "You got great hands. You should really do something with your hands." And then I got injured in high school playing football. I went the medical direction, and my family was wondering why my grades were dropping because I was in pain from the injury.
Okay.
So then they finally said, we got to do something different. And they took me to a chiropractor. I was a sophomore in high school and got better. And I said, oh, that was interesting. And then had a girlfriend my senior year whose dad was a chiropractor. And that just kind of kept happening. And I looked at it, said, I think I want to go more allopathic medicine. Went to Fresno State for undergrad and was doing pre-med stuff. And then I talked to a lot of medical doctors. They said, don't go into medicine. It's changing. It's becoming very corporate. Physicians aren't able to make the decisions. Insurance companies are making the decisions. I knew a lot of happy chiropractors, so I decided to go into that for myself. After about 3 semesters, I'm like, I'm not sure I want to do this. And end up doing a lot of research with other professionals in our organization at the grad school. Then became what I'm really wanting to do is that integrated approach is what we have now in this practice.
Awesome. Sounds great. And then what about you, Dr. Wolfe?
Boy, I started years ago. I was a personal trainer and a martial artist, and I saw a lot of injuries
Really?
that were not being addressed. I used to fight or compete against other countries and stuff, and I met some really good martial artists in Hawaii when I was there, and they introduced me to a little bit of like functional medicine back then, and I started going, well, this is really cool. These aren't drugs. This is like really good. So there were some good stretch techniques and things like that, and I just put it in the back burner, and then years later, my family got sick. And after years and years of mistreatments and not finding the cure, I said, okay, I got to do something about this. So I started looking into medical schools, attended UNR for a little while, and left and ended up just really being dissatisfied with that. So I started learning from India and spent 6 years learning from the Indian teachers, homeopathy, Ayurvedic medicine, and a lot of physiology. Left there and went to Greece, learned from George Vithoulkas, who's been teaching in the European Union, a lot of the doctors there in homeopathic medicine. And I was thinking, man, I cannot believe the depth of the healing coming across this. So then on my trip back to the United States, I met Vega Rosenberg, who lives in Cyprus, Israel. Started learning from him, and he's a rabbi and a very, very good homeopath and a very good doctor. Started learning from him a lot of techniques you don't even hear about anymore. So graduating from all these different places, came back to just applying it here and finding out there's some phenomenal results we can get.
Wow. What kind of martial arts did you do?
I did Shotokan at first, and after I got beat up a lot, I started doing Wing Chun. So
I see.
Yeah.
Do you have a lot of people who come in with martial arts injuries?
A few.
I did MMA, so.
Oh, both of you have a background in martial arts. Okay, wow.
Treat a lot of MMA fighters.
Okay.
And boxers. And actually part of what we do with our rehab is boxing.
Oh, interesting. How do you do that?
The gym next door, I was set up for it.
That's so convenient.
Yeah.
Wow.
And then you'll see on some of our videos, I've got a lot of Parkinson's patients that I like to work with.
Yeah.
Part of our training is hand coordination and feet coordination.
Okay.
And we do it through boxing.
Wow.
Kettlebell
That's
work
fun.
and strengthening. Yeah, it's a lot of fun.
Yeah, that's
the
more
reaction
exciting.
time. Yeah, it's really kind of cool.
Yeah.
And then do you also see people come in who had similar cases to what you went through with football injuries,
Oh, yeah.
Vicodin usage? What do
Yeah.
you do with stuff like that?
Look at it functionally. I'll give one example. A young man who was out of Fallon, I'd been treating him for a while since his junior year in high school, and then he was a high-end track star for Nevada 2-3 weeks before state, and he was looking like he was going to take all state, and he pulled a hamstring.
Ooh.
And he couldn't walk.
Oh no.
He took state
Oh,
because
okay.
of the treatments that we do here.
Wow.
We were able to get him to where he could actually compete and won.
Wow.
So You know, that's our clinical experience that we have, but we're very evidence-based practitioners. The fact that we get these outcomes in some really amazing way, me on the functional medicine side, the mechanical side, and Dr. Wolfe on the metabolic functional side, the two combinations, there's just nothing else out there.
Wow.
There's individuals that do what I do. There's some individuals not necessarily here that do what Dr. Wolfe does, but the combination does not really exist, and that's what's really exciting.
So there's not a lot of people in the area that do what we do. And it's, for example, the gal we had the other day with the stiff shoulder.
Mm-hmm.
And I had her in the room doing some exercise with her, probably about 10 minutes. And she went from here, you know, couldn't raise her arm to all the way up here. And she goes, you know, this is awesome.
Yeah, it's both mechanically
Mm-hmm.
with what we have, it's called shockwave. We're breaking up calcification on the supraspinatus ligament.
Oh.
I'm doing it externally, but then he gives her the proper homeopathic remedies
Okay.
to do it internally.
Wow.
So we're hitting it from both angles. This is shockwave, pressure wave. It uses percussion technology, and they basically took it from the same technology it's used to break up kidney stones. Normal tissue, you don't feel a thing. But if it hits a spot that's been damaged, you feel it. And it feels like being snapped with a rubber band.
Okay.
So we have to keep doing that until that stops. It's repairing that tissue.
Mm-hmm.
And what's really crazy about this one, it's also rejuvenating tissue. They use it for ED, and I use it for peripheral neuropathy on the bottom of people's feet because their basic issue is they don't have blood flow.
Mm-hmm.
And this is able to improve that. One of the things that I'm really passionate about are injured workers.
Yes.
We call them our industrial athletes.
Mm.
And right now, we're working with the fire department because these guys and gals get injured, but they're very motivated to stay working. And it's a passion. They're very passionate about it. There's a lot of people that'll get injured and they won't have the aptitude to do the work that is required to get back on duty. These folks, because their livelihood depends on it, are very motivated, and we have a program in place that's going to help a lot of people that don't have the access like professional athletes do.
I mean, I'm sure you see it all the time, even with people that we know in everyday life, with my friends. People get injured, but they put it off. They don't think it's that big of a deal. They don't want to go to the doctor. And then it just gets worse,
Exactly.
right? And then they come in, and by that time, it just ends up being so much more
It's chronic
than
at
if
that
they
point.
came in earlier.
Yeah, I'd much rather have somebody that was just injured than waiting 6 months. I always tell them, you waited so long, guess what? You've got to be re-injured, break down all of that scar tissue for us to now start over.
Ouch.
If you would have come in 6 months ago, you'd already be healed and back in doing what you love to do. And people don't grasp that concept. The younger you are, the more likely you are not to pay attention.
Yep.
And there's a saying, when you're older, if I only would have known it would have been like when I was older, I would have taken better care of myself when I was younger. I always like this saying, are you sick and tired of being sick and tired?
Yeah, who isn't?
Yeah, and so do something about it.
Exactly. We have the resources available. We
Yes.
got to take advantage of it.
But the other thing is, too, you have to be responsible for your own health.
Mm-hmm.
We call it health care in our office, not sick care. Our healthcare system is not a healthcare system. It is a sick care system. When you're sick, you go in. What do you do when you're healthy?
Exactly.
Right? We want to keep you healthy. That's why you come to see us. We don't want you when you're sick
Yeah.
because then it's late and we have to start all over again.
It's so much worse.
And that's what people don't understand is our healthcare system isn't set up for you to stay healthy. It's for you to be sick. We have to change our mentality, and insurance doesn't pay for you to be healthy.
Oh, yeah, of
It
course
pays
not.
when you're sick. So people need to recognize they have to be accountable and responsible for the cost of staying healthy. And I don't know who exactly said it, but a healthy person has 1,000 dreams. A sick person only has one, to be healthy.
Wow. We talked about your origin story, what got you here. What are the top 3 pieces of advice you would give to someone just starting out in med school?
I think anybody wanting to get into health needs to go work or volunteer in the area that they're interested in. They need to see if this is really what they want to do. And we've actually had students change their discipline based on what they see in this practice. Don't go through all the schooling and then find out, because it's happened.
Oh, yeah.
People go into medicine and go, this isn't what I thought it was going to be.
Mm-hmm.
I'm not going to do it.
Mm-hmm.
And understand that there is more to it than just what you're learning in school.
Mm-hmm.
You have to be a businessman, a woman. You have to be a sales and marketing person. You have to be an accountant and a bookkeeper. You have to be a legal person. There is so much more to it than just being the doctor.
Yeah.
And so that's my advice, is making sure that you like people. You don't mind touching people.
Right.
You can actually talk to people. If you are an introvert,
This is not for you.
You might want to be an anesthesiologist, because you don't have to talk to anybody.
Yeah, and we have to be willing to go to the core, the start of the illness. A lot of physicians don't do that.
They don't have time.
But they really don't have time. And the thing is, it's just, you need to listen to your patient to find out what the problem is.
80% what you need to know.
Exactly. You cannot assume what's going on.
So if you could go back in time to your med school self, what is one thing that you would change?
I think for me personally, there's one of the questions about what would you do if you weren't in this? And I'm an entrepreneur. I love building the business. I think for myself, if I knew today and could take it back, I wouldn't have got so sidetracked with so many different entrepreneurial things in healthcare. I would have stayed focused on what my real passion was, and that was healing people. But I really wanted an integrated approach. The problem was nobody knew what that was. And so it's to really be what we like to call that bleeding edge of technology or your specialty, and don't listen to people saying that that isn't something that you can do, because we're doing it. I wanted to do it 30 years ago, and I think I got sidetracked because it was not easy to do. Stay focused on what you see as your desire to have an integrated functional medicine practice, and don't stop.
Did you know that's what you wanted to do from the beginning?
I knew, based on my experience and the university I was at and the engagement that I had with so many different providers, that that's what I wanted to do. There was just nobody doing it.
Okay.
So I was really out there on the fringe.
On your own.
And on my own, and even restarting this practice in Reno in 2016. And it has taken 8 years. And now I've got Dr. Wolfe here, and I've tried a lot of other providers, and now we've got something that is really special. And
A good team.
And yeah, a great team, and our staff's great. I think another thing is it doesn't happen overnight. Just stay in the game. And if you leave it, you're not going to ever achieve it.
No, definitely. It's the long game.
It really is. Yeah.
I mean, what about you, Dr. Wolfe? Is there something you would change about your med school journey?
Well, I wasn't planning on that whatsoever. I thought I was just going to be a worldwide martial artist, and that was about it. And I had no plans on doing it, but circumstances come up to where you get so frustrated with the system that your loved ones are not getting any better. And it was just out of frustration and a desire to, okay, let's take care of this myself. When my journey began, I saw so many failures, and I wanted to do something about, let's get some actual results that actually work.
Yeah, I have to say, too, for me, what I do today, I never learned in school.
Oh, of course not.
And you have to be willing, as a practitioner, to look at what is coming out there and say, this is going to benefit my patients.
Being in healthcare for 35 years, you said that you went to India, you own multiple different locations. So out of all of your years of experience, out of all of your locations, what would you say is the biggest challenge of being a business owner?
It's running the business.
Mm-hmm.
Knowing that you have solutions for people, but letting people know that you have it. That's the biggest issue. And we're not set up to have a huge marketing program. We're not the local hospital. We're not a big multi-physician group. And we're not heavy on the insurance side because, again, they don't want to pay for what we do. It comes down to the patients doing it and being responsible for their own health. So letting people know that we are here, that's the biggest challenge. Yeah. And even when they hear it, they still question it. You've got big pharma on TV, you've got the big medical industry saying that there's no cure for things. And so when we come up with a solution, they go, why weren't we told this? Because there's no advantage for the industry to look at alternatives. I think that's going to change, but it's still very competitive in regards to follow what we do, not what they do, because that'll affect our income.
Speaking of alternatives and solutions that other people don't hear about until they come to you, Dr. Wolfe, you were saying earlier there was a story about a kitten at a veterinarian.
Yeah.
Can you talk about that?
I was called a while back. One of my clients, she said, will you help me with this kitten? It's a newborn and it was getting its first shots, and I guess the kitten had moved, and so the veterinary assistant accidentally injected into the spine. And so what happened was the rear legs of the kitten just went flat. And so it was trying to walk like this, dragging the feet along behind it.
Mm-hmm.
And so the veterinarian kept it and did what he could. And they finally told the owners that we're going to have to put the kitten down. She's crying and she calls me up. She goes, what can we do? And I said, okay, there's a remedy I learned about in India. Let's give it a try. So the first day, the remedy, she was given 2 doses. Kitten started trembling. And she goes, is that normal? She calls me up. She panicked. And I said, well, it's probably the nerve endings are waking back up. By the second day, she gave another 1 dose. Third day, another dose. She calls me up excited. She goes, the kitten is walking again. The veterinarian then called and said, what is going on? What did you do? So I explained what I did and how we do it, and phenomenal results. So it's just, if you look at the core, what happened, traumas that are involved, I mean, you can get to the core and you can pretty much alleviate a lot of the suffering.
It really makes a difference
does.
for who you go to for these issues, because
Absolutely.
if they didn't come to you, then the kitten would have been put down.
Yeah, unfortunately, yeah.
Well, you just take that to the next level. How many people have that issue? I mean, the reason why what he says in regards to the kitten is so important, because there's no placebo in that.
Yeah.
Mm-hmm.
The kitten's not pretending.
Exactly.
The kitten doesn't know any different. It's just functioning. We have an instrument here called a Category 4 laser. That's been around for 40 plus years, and we just started using it on people about 15 years ago. There are videos on YouTube where you can see a penguin that had a limp. They did a 30-second, 1-minute laser, and it ran off. So what we have here is a Category 4 laser. So this is a repair and rejuvenating form of treatment.
Okay.
This doesn't really create any new tissue, but it repairs what's broken and what needs to be regenerated or rejuvenated. So it penetrates 3 to 4 inches deep. The mitochondria in the cell actually absorbs photons like a tree does with its leaves, and it uses those photons to create energy. If I wanted to fix a wrist, I would just actually be moving this across the wrist, and the laser would penetrate all of the tissue. There's so many things out there that people just don't know about that we're doing in this practice.
Yeah, definitely.
For example, how many people know about nitric oxide?
I don't know. Inform us, please. Educate us.
So nitric oxide is a normal molecule that is supposed to be produced in our body. They did not understand what it did until 1998. It won a Nobel Prize for science. And the scientists said every cardiologist need to be prescribing nitric oxide to every cardiology patient. How many cardiologists do?
Probably not a lot.
0.
Why is that?
It's a nutraceutical. It's not a drug.
Oh, interesting.
Okay, so Big Pharma's not pushing it. And it's a natural molecule that our bodies are supposed to make. For some reason, we're not making it anymore. And I think a lot of it has to do with all of our electronics. We're getting young folks in here that are completely blank of nitric oxide, and you have to have it. And if we don't have it, we're depleting it. And we're getting people, young folks, that are fainting, bad blood pressure issues, they can't stand, and nobody knows why. Well, this is one of the nutrients. I had an 83-year-old lady come in with what we call peripheral neuropathy. I tested her nitric oxide, and it was on target. You should not be producing any nitric oxide in your body anymore at 83. She still lives on the same farm she did growing up.
Okay.
She makes her own organic vegetables, which are fed with fertilizer from her animals, which is where the nitric oxide comes from.
Wow.
She has no computers, no Wi-Fi, no 5G, no Bluetooth. So she's not getting oxidated nitric oxide from all electronics that we have all around us. And she's getting the nutrients through her diet.
Wow.
But none of us do that. Nobody lives like that. Yep. And you need to read what it does for brain function, what it does for cardiovascular, what it does for gut, what it does for sexual benefits.
Yeah.
Our planet's trying to kill us, and we're not paying attention, from the toxins, from the pesticides, from the heavy metals, and the microplastics. So if you want to stay healthy, you have to come and see us.
That's crazy.
Yeah.
That's something I've never even heard of before.
Exactly. We are here to educate people.
Yes.
Look at say
Depleted?
depleted.
No nitric oxide?
No nitric oxide.
I just had a gal in this morning. She's fainting and she's dizzy. And I'm like, you have no nitric oxide. She was completely gone, and her arteries can't vasoconstrict and dilate, which is what we need when we stand up and sit down, because the pressure changes. And it's going to be a simple 2 tablets a day type situation, which will probably change a lot of it, instead of taking a blood pressure medication or other things that aren't. And I like always saying this, our body is not depleted of statins. It's not depleted of Norco. It's not depleted of ibuprofen. It's depleted of vitamin D and calcium, magnesium, potassium. Our bodies require B12, requires nitric oxide. All of these things is what our body actually needs to function. But what we end up doing in this industry, in this society, is using a drug to cover up how we're feeling, not fixing it.
That is so true.
Or the high caffeinated drinks.
Oops.
Yeah, Red Bull and so on and so forth.
Oh, that stuff's so bad for you.
Oh no. You guys have been in business for so long. You've seen thousands and thousands of patients. What do you think is the most surprising thing that you've learned?
I think for me is the expectation that it doesn't matter what I do, my body will be fine. I can eat what I want to eat. I can not sleep. I can go out and party. And then all of a sudden things start catching up and going, I don't feel that good. I get a lot on the men's side where they said, I'm just aging. I'm just getting old. No. Yeah. Age strong, man. My dad's 80 years old and he has Parkinson's too. And he is stronger than some 60-year-olds.
Yeah. There's so much out there. It's a world of information. So what would you say are the top 3 pieces of advice that a new doctor should avoid making? Like, what mistakes should they avoid making?
I would say a lot of them, I'm going to say, suppose, and that they have a specific issue without really getting enough information. Because right now, most doctors are relying on the MAs and the nurses to fill in all the medical history.
And the pharmaceutical reps.
So they're not actually having the time to interact with the patient to find out what's really going on. Because they're looking at a specific test. Sometimes they only look at one titer in the test, and then, hey, this is what we're going to base it on. Don't blame the doctors. I blame the industry for not allowing enough time for that doctor to do his work.
Yeah, and I think so too. And I've heard this a lot during COVID. These are our protocols. This is what our system says we have to do. Doctors are so isolated, and from specialty to specialty to specialty, and it's like you can get more narrow, and you're not looking at the whole human being. You're giving this antibiotic, and it's shutting down their kidneys. Well, they have this, we need to kill the bacteria, but you're killing the patient because their kidneys are shutting down. It's like, look at the patient. Don't look at just your protocol. And I think for physicians that are coming into medicine, they need to be more open-minded and not just be a soldier following orders. And you're seeing a lot of doctors now that are getting out of medicine because they're recognizing what I'm doing is not making the patient better. It's making them worse. And why is that? Because it's too specific. I mean, there's just so much more to us than just one single body part. Allopathic medicine is fantastic for acute care, but it doesn't know what to do with chronic care. It's not set up for that. And the medical community is starting to recognize that. But you got big industries that are so oriented towards we're going to treat everything in an acute care mindset. Yeah. And it doesn't work.
I had a client come up to me, and she had a chronic condition she had for 30 years. And she said, how long is this going to take to cure? And she goes, well, my doctor said if I take this, I'm not going to have these symptoms. I said, are you suppressing them? That when you suppress a disease, it goes deeper into the body, into the core. I said, the first line of defense for a body is to exit whatever's in there. Like, say, for example, you have allergies, your eyes start weeping. Okay, that's the body's natural defense. Get it out of there. So what do we do medically? Let's stop your eyes from weeping. Okay, then it goes down to the nose, ears, mouth, it goes into the throat, the chest.
It affects everything.
Urinary, fecal, and finally it comes out the skin. Yeah. And you go, why did you allow it to be so suppressed and push that back into your insides? If your eyes are watering, take allium cepa. It's a red onion. Make them weep more, flush everything out. You know, it's just, there's ways the body works, and there are ways that industry has changed the way the body works.
I mean, for example, throwing up,
Yeah, absolutely.
having diarrhea.
Yeah.
What is your body trying to do? Get rid of it. And there's a lot of truth that we stop our system's ability, even like fevers. Don't reduce your fever unless it gets to a certain level, because your body is increasing your temperature to destroy viruses and bacteria. There's a reason why you have a temperature. And as soon as you reduce that temperature, it's not killing the bacteria or virus anymore. And guess what? Now that virus and bacteria gets to grow, because you just created an environment for it to grow. Cancer cells, sugar allows it to grow. There's so much we can do to reduce the risk of cancer through proper nutrition, fasting, how you prevent it. You can actually destroy cells in your body. Your body will do it for you.
Yeah. You talked before about how so many doctors just follow the procedure, they follow the book, there's no thinking outside the box, no creativity or alternative paths. Do you have an example of a time when you went outside procedure and it worked out for the better?
All the time. We have one gentleman who was referred to us by a nurse practitioner. There wasn't anything else you can do for him. He had had 3 concussions. And the last one, he was pretty much staying at home. He was on disability. He couldn't work anymore. He had night terrors. He had all of these different things coming up that I'm like, let's do what we do. Let's get his nervous system working. Let's get him on nitric oxide. Let's have him use our Emsella equipment to help with his pelvic floor. I'll do what we call cranial work. 3 months later, he went on vacation for the first time with his family.
Wow.
And I was like, okay. I had no expectation. I just did our program, got the nervous system working, got his blood flow working, got his pelvic floor working, and it changed his life. And now he's riding his motorcycle.
Which I'm sure he never thought he could do.
I feel something. Oh my God, what is happening?
So we're doing the Emsella. This is for pelvic floor strengthening.
Okay.
So the interesting thing about this technology is its capacity to do 12,000 Kegels in 28 minutes. And for you to try to do 12,000 Kegels in that time, you'd never be able to do it.
Right.
Even in a month.
Yeah.
So it uses MRI technology where it comes in through the middle of the groin and expands out into the glutes. And there's these little tiny muscles in the pelvic area that keep the organs from falling down.
Okay.
Okay? And so this helps strengthen those muscles, increasing muscle mass up to 35, 38%. So it's not just fixing the muscles that are there, but it's actually generating brand new muscle building.
How often do people do this?
So the treatment schedule is up to 6 treatments,
Okay.
and you do it every 3rd day. Our issue in society is that we're just not building our core anymore. We sit too much. We drive. We're watching TV. We're on the computer,
Sit a
right?
lot, yeah.
So we're all doing this. We're all losing muscle tone.
Right.
We're losing glute muscle tone, abdominal muscle tone, and then the pelvic floor. We're losing all of that. So by doing these pieces of equipment, we can get in 6 weeks repaired and built, and loss of fat tissue, visceral and subcutaneous, that would take you 16 weeks to do on your own.
Okay.
6 weeks versus 16. That's a significant improvement.
Yeah.
Yeah, and this is both for men and for women. So any ladies that are just had children, the whole pelvic floor gets very weak,
Right.
right? Because you got all of that weight pulling down on the pelvic floor. So ladies in their 30s to 40s, and then premenopausal, you feel like I've got to go and cross my legs
Yeah.
because I'm going to sneeze, right? And that leakage, that
Yeah.
urinary incontinence.
Yep.
Okay, and you're feeling that. It's
Yep.
contracting that.
Yeah, it's just not a feeling I'm used to, so.
No. No, and
Yeah.
some women like it. That's why we have a door. You got to close it.
Give people their privacy.
Yeah, we let ladies, and then there's a line standing out there. One actually interview, they said it was almost orgasmic.
Oh, of course, sure.
Yeah.
I'm sure they wanted to come back for more.
Yeah. And then as people get older, there are more adult diapers sold than baby diapers.
Oh, yep, that's very true.
So a lot of our ladies, one treatment stops it.
Wow.
We actually had a lady, 20 years of fecal incontinence. She would literally, every place she went had to plan to be right by the bathroom for 20 years. Third treatment into this,
Yeah.
it stopped.
Wow.
Third treatment.
You really
Changed her life. It also affects men with erectile dysfunction, prostate issues, frequent urination at night. Same type of situation. So that was the big one for me to see. And that's what keeps me coming into this clinic every day. And why I don't want to stop. It's like, when are you going to retire? Why? Why do I want to retire? Really, the thing I want for Dr. Wolfe and I in the next 2 to 5 years is I want us to start training our replacements, because nobody knows what we know. I want to get a young chiropractor. I'd love to get another young MD and mentor these guys to take over for us and then build on top of that. I'd love to teach. I love to train. The worst thing that Dr. Wolfe and I can do is to take this with us to the grave.
Well, that's great for the audience to hear. If there are any aspiring chiropractors out there, any doctors who are interested, anyone, Reno, Nevada, reach out. Maybe 100%. This might be a good opportunity.
Fantastic. I like that idea.
One of our issues is just people don't know what's wrong with them.
Yeah.
They don't know where to go.
They don't know.
They just don't know where to go. And our big thing is we don't want to see them back. We want them to heal and refer. If they don't heal and they keep coming back, we're doing something wrong.
I've always had the saying, I'd rather see 1,000 patients 3 or 4 times than 100 patients 100 times.
Exactly.
That's rough on us and it's rough on the patient.
Yeah.
Has there been a defining moment in your career where you've really stepped back and been like, this is why I do what I do?
For me, patients with vertigo, people that could barely stand up without falling over, and as soon as they sit up, they feel like they're going to throw up. We've been getting that from other medical practitioners. It's like, we don't really know what to do. We can give them the medication. I probably have 40, 50 vertigo patients that are consistently in our practice. But I had one young gal, treated her about a year ago, and she did phenomenally well with it. We do the nitric oxide, we do cranial work, we do the adjustments. I do an adjustment on the ear that opens up the Eustachian tube inside the inner ear that helps with flow. It's stuff I learned from a 90-year-old chiropractor decades ago. So there's a lot of these old technologies that we don't want to lose. But I did this on this patient. She felt phenomenal and then had other health issues that she thought was causing her vertigo. And I'm like, no, this is something separate. And she left. And then about 3 or 4 months ago, came back in excruciating pain, could not drive herself here. She was supposed to drive to Oregon. She was crying. She was in so much pain and could barely sit up and move. And I said, you needed to stay and continue treatment. I said, let's get this going again. That day, she walked out of here already, I'd say 40, 50% better. And we spent 3 months. It's gone. And now she comes in twice a month to maintain and prevent it from ever coming back again. That is life-changing.
Oh, for sure.
And people don't know that have vertigo that there's a solution. We got peripheral neuropathy people that I had one patient drive through his garage door because he thought he was on the brake and he was on the accelerator because he couldn't feel his feet. And we fix that. We don't cover it up with gabapentin and Lyrica. We actually get their feet feeling again.
Yeah, you go to the core.
Go to the core. And so that's a huge one, peripheral neuropathy, and people don't understand it.
That's scary to be in a situation like that where you drive through a garage door because you think you're fine. Yeah.
Okay, so these are our peripheral neuropathy boots. The whole issue in regards to peripheral neuropathy is, although the nerves are dying, it's about what's on the outside of the nerve called the myelin sheath. It's a fatty tissue. And the reason why people stop feeling their feet, or they can't feel pressure, or that tingling, or where it feels like spiders walking on their feet, it's because the nerves are not functioning well anymore. And they're not functioning well because the blood flow is gone.
Right.
So these boots here, we have patients put their feet in it for about 20 minutes along with vibration, and it helps bring that blood flow back and starts reducing the problems with those nerves. and they can start feeling their feet again, be able to start walking again, have better balance.
Prior to working with Dr. Waldorf here, I worked with 2 other clinics, and prior to that, I was just like online clients from India, Newfoundland, Israel, Australia. So I was doing, like FaceTime with them and getting really, really great results. But I said, there's not enough hands-on. I got to do something locally here. There's so many people moving into our area all the time, and if you can't tell, look at the traffic. But I mean, there's so many people that need our help, and so yeah.
Well, what is the procedure that you guys are seeing all the time? What's something patients come in asking for that they can't get enough of?
It's not so much a procedure as a condition, being able to move without pain. Continue to age, it only gets worse.
Oh, yeah.
Because in our 20s, 30s, and 40s, we're not paying attention to it, and then all of a sudden it hits us. So it's not really a procedure, like I said, as much of I want to feel good. I want to feel strong, have vitality.
Yes.
I want to have that, and I don't want to feel like I'm aging.
So outside of injury repair, what do you think is the most exciting thing about the practice?
Being able to fix people's joints and their back because they injured it lifting something is what we do on a regular basis. But to take it to the next level, to rejuvenate, so not just fixing it, but repairing the tissue and making the tissue stronger. But what's even more exciting is the regeneration part. Rejuvenating is to fix what's already there. Regenerating is building something brand new. And we're finding out that a lot of tissue can be rebuilt.
Wow.
Yeah. Nerves can be rebuilt. Collagen can be rebuilt. You see some people that start working out in their late 50s, early 60s, 3 or 4 years later, they're buffed. They have muscle mass. Because people think, and we hear this a lot from patients, well, the doctor said, you're just getting old. That is such a cop-out.
It's an excuse.
It's an excuse for not doing anything. So for me, yeah, I want to take care of people that are injured, but I want to take them to the next level. I want to rejuvenate them and regenerate tissue. So with our Shockwave, our Category 4 laser, the Emcella, which helps with pelvic floor strength, and the M-Sculpt, both for sculpting, building muscle mass, reducing visceral subcutaneous fat. And now we have another application to it called functional M-Sculpting. That actually rebuilds all of the tissue in the area we're working on, the bone, the cartilage, the ligaments, the vasculature, the lymphatic system, the nervous system. It literally rebuilds it. We had a 17-year-old soccer player, and he's been coming in for years because he'd keep hurting his knees, and we'd laser it, and it'd feel better. I said, I want to try this new system. And he goes, my knees have never felt stronger after doing M-Sculpt Neo Functional on it. So we're going to start doing M-Sculpt Neo body sculpting. It's going to produce anywhere from 35 to 38% increase in muscle mass in the abdomen and about 48% reduction in visceral and subcutaneous fat. So we're going to get that started with the heat first. And now we're going to start getting the contractions going. And then there's going to go a phase where it's going to start removing the lactic acid from the muscle and move it into the lymphatic system for removal. This is for muscle building.
Muscle building.
And for losing visceral and subcutaneous fat. You've got 20,000, 22,000 contractions in 30 minutes. What does that mean for your muscle? It needs energy.
Okay.
Okay. Typically, when we go and we work out this month, we go into spasm because there's not enough nutrients, not enough glucose into the muscle itself. But what's really cool about this system is we're doing all of that contraction, but at the same time, we're heating up the fat cells and releasing the triglycerides out of the fat cells to feed the muscle to do those 22,000 contractions. So we get such a crazy increase in size reduction. You see a lot of people that lose weight, they don't look healthy.
Right.
Because it's a reduction in the fat, but nothing else. And a lot of times they lose muscle. Where this one, we gain muscle. We also have a functional side, which is a different frequency that does a whole bunch of joint repair. And ladies, after about 2 or 3 treatments, are starting to see their six-pack.
Oh, wow.
That fast.
That's really quick.
It just, because it's getting rid of that adipose tissue and building up the muscle. But it's so funny because some gals that come in say, I want my muscle work done, but don't you touch my shape. I want that booty staying there. And I'm like, okay, whatever.
Yeah.
So we don't turn the heat up on them.
Oh.
So we keep that visceral fat down because they want to keep the booty shape.
I see.
But we want to build the muscle. For me,
yeah,
I just got to work the whole thing. So that is regeneration. That is building brand new tissue. And then we do hormone balancing, which you have to have testosterone in your system to rebuild muscle, to rebuild ligaments and cartilage. And then we also do more advanced stuff like PRP, platelet-rich plasma, where we pull blood out of your body, we spin it, and we take the healing factors on top and put it into your joints. I've had 3 done on this knee. All the years of football and martial arts destroyed the meniscus here and once in here. And now I don't get the popping. Every time I'd get off a stool, my knees would pop. Totally gone. Now we can literally age strong into our 70s, 80s, and 90s. People think that they have to accept aging.
Oh, yeah.
And they don't.
So you just named so many different procedures that you guys do, so many different pieces of equipment you use. What advice do you have for someone who's researching what new equipment to bring in?
My biggest thing for a lot of docs out there is get with a group of other docs. Have your tribe, because we have a tendency to want to live on an island and we keep throwing stuff onto the wall to see what would stick, right? But if you have 10, 20 other docs with different experiences coming back and saying, I tried that, it didn't work because of this, this, and this. Maybe you might want to tweak it or not even try that with this marketing or that. That is my number one recommendation. Don't be afraid of competition. And I got chiros here now that are coming into my practice for services, and they're sending me patients, and I'm working with them. When you are strong and confident in what you do, you don't have to worry about other doctors.
With all of your years of experience, you guys have gone through so much. What's the biggest stressor that no one prepared you for?
Having to show up every day and run the practice. I'm the CEO of this clinic now, but I had another doc. The biggest stressor is making sure you have the right team. And what I would recommend, if any docs that are listening to this, don't settle for C-, B- players. Look for your A players. I'd rather pay for an A player that can work and do everything than pay for a bunch of B-, C+ players that don't do as well as the one A player. Because most people get worse, not better, once they get comfortable in your business.
Oh, yeah.
Don't burn yourself out. Don't be in your practice 7 days a week. If you don't take care of yourself, you're not going to be here for anybody else. So there is that aspect. But when it comes to your business, be prepared that it's going to be more than being the doctor.
So out of your years of experience, you've seen thousands of patients. Do you have any creative client requests that you could share with the audience?
I think the biggest thing right now is the weight loss thing.
Ooh, do you see a lot of people come in for...
You were seeing some patients today coming in for their weight loss product. People think the GLP products are the way to go. I don't know if they realize that was made for diabetics. There is a reason why they have to have that. And when people that are normally physiologically functioning use something that is not meant for them, there are side effects. We're seeing what's called spastic colon. It goes after the muscle fiber, and so the colon can't control, so the colon goes into spasm, and then you have to run to the bathroom. There's some facial issues like facial tics and stuff like that, because you are reducing the capacity for your body to use insulin. So you're not opening up the cells to allow for glucose to come in. And the muscles need glucose. The brain needs glucose. And you're shutting that down, and you're not eating. So people think that this is a panacea. And it is not. As soon as you get off of it, you got to start eating again. If you don't create a system for yourself, like we do in our practice, we do intermittent fasting. We do what we call fasting mimicking diets. That is teaching you to utilize your body's capacity to reduce the need for insulin and the need for glucose. Our bodies are amazing if we know how to work with them. There is a phase in the intermittent fasting by the 3rd day of reducing your caloric intake. It's called autophagy. Autophagy is basically your body by the 3rd day of fasting going, hey guys, we don't have the calories that we normally have. We're going to have to start shutting things down. It happens at the cellular level. The mitochondria, the engine of your cell, will actually shut up portions of the cell. Say, we don't need that right now. So we're not going to use that. Also, the cells that are like limping along and everybody just kind of puts up with, by that third day, the body's going, we don't need George over there anymore. We need to get rid of him. He needs to go get eaten up for energy and eliminated. That is inflammatory cells, that's precancer cells, that's cells that are affecting people with MS and Crohn's disease. So the body will literally get rid of the cells that are no longer functioning and get rid of them and reduce the amount of calories your body needs to use. The really exciting part is the 4th and 5th day. So let's just say you've leaned all of the unnecessary things out of your system, but then you start increasing your caloric intake again. And the body goes, oh, we have energy now. We need to now start pulling stem cells out of the bone marrow and replacing George and Nancy and all the other cells that we got rid of with brand new cells. So that 4th and 5th day, you're actually anti-aging. Okay. This is where we start reversing age, is because on that 4th and 5th day, you're replenishing all that old, dead, cranky cells into brand new youthful cells. What's also really interesting is this Dr. Longo with the program that we run, the scientists out of Europe, they analyzed that when you go through that 2nd to 3rd day, it creates a protective coating around cells. What doesn't happen is the cells that are not functioning don't get that protective covering. So like cancer cells, they don't get it. So they started looking at what happens if you give an FMD diet to people on chemotherapy. They don't get sick because it's going after the cancer cells and not the healthy cells. The healthy cells don't absorb the chemo because they got this protective covering that it's occurring because of that fasting action. And what is typical in cancer is people are hungry. So they say eat. They're feeding everything and opening everything up to the chemo, including healthy cells. So there's a lot of interesting things that our body can normally do that we don't know about.
So do you recommend fasting and detoxing?
If it's done correctly.
Look at it this way. When you're digesting, a lot of your body's energy is going to digest foods rather than rebuilding tissue. You want to fast so that your energy can go and start doing repair rather than digesting food. It's just, where do you want to expend your energy? So the fasting is really, really a good thing.
Well, going back to what you were talking about with this trend in the industry right now, right? With weight loss, GLP-1s, Ozempic, do you have patients who come in and just really need your help after doing something like this?
Yes, they get used to using a drug to do the work for them. You can't stay on it forever.
Oh, of course not.
Your brain doesn't want glucose. It wants ketones. And our bodies can make that, but our program, we actually give you what's called exogenous ketones, where we can get you into a ketone level of nutrition a lot faster. And there is so much benefit to utilizing ketones because you don't need insulin to feed the cells. Nobody knows ketones. They hear a ketone acidosis, oh, that's not good for you. If you're diabetic, it's not. Yeah.
Wow. Well, I know we are almost at time, but one of the last questions for you guys, you talked about having a support network, meeting up with other doctors once a week, you have a community. Is there a piece of advice that you've received that has reshaped the way you do business?
Business-wise, it's not following the old healthcare model of fee-for-service. It nowadays can't survive waiting for insurances to pay you. I mean, sometimes we're waiting a year to get paid for some things that we do through insurance. And then they can say, you didn't bill correctly. We still have bills every month. You cannot depend on the insurance industry to pay your bills. With the group of other doctors that I've spoken with over the last year, coming up with really strategic ways to help patients pay for their health care. And, being able to utilize different funding programs and financing programs so that they can get the services and the care they want, and we can keep the doors open. That's the biggest one.
Awesome. Well, thank you guys so much for your time. We appreciate it.
Yeah, absolutely.
Awesome. And this has been the Nitra Channel.